So, a very warm welcome to this World Sepsis Spotlight event on behalf of the Global Sepsis Alliance and the Physician-Patient Alliance for Health and Safety. I'm Louise Thwaites, and I'm coming to you today from Ho Chi Minh City, Vietnam, representing the Asia-Pacific Sepsis Alliance. And it is my great pleasure to be not only co-chair for the event, but also moderator for this opening session. So over the next few hours, we've got a really exciting lineup of speakers coming to you from all over the world. We're going to be hearing about some of the amazing progress in the fight against sepsis, but I think also hearing that we still have a very long way to go. And that's why we wanted to focus this meeting on unmet needs in treatment and diagnosis of sepsis. So we have 9 sessions for you, over 45 speakers and 20 from 25 countries, and they are going to be presenting on a very diverse range of topics. I'm happy to say we have 50 medical advocacy and medical organizations supporting the event, and most importantly, over 11,000 participants. So thank you for joining and attending today. Thank you for our sponsors who are here and have enabled this to be free for all participants. We want this to be a really interactive event, so please make use of the chat function, post your comments, questions and answers. Nearly all of our speakers are here live, so they'll be able to answer the questions, and the session moderators will be able to pose the questions directly to them. Reminder that there is CME available for the event, so please register for that. And while the event is live, you will be able to go back and listen to sessions that occurred earlier in the Congress, perhaps if you were not able to join because of time zone issues. Thereafter, from the 7th of May, we're going to be releasing a session every week, and you can subscribe to our YouTube or podcast channels to download those sessions directly. So I'm really looking forward to the next few hours, and I really hope it is going to be an enjoyable but informative event. But perhaps most of all, I hope it's going to be inspiring for all of us. And with that, I'm going to pass over now for some opening comments from the president of the Global Sepsis Alliance, and that's Professor Dr. Tedros Kissoon. So hello, Tex, and over to you.
Thank you very much, Louise. Distinguished guests, Director General of the WHO, colleagues worldwide, and friends also from many of our sepsis agendas. Thank you very much. I would like to really welcome you to this, and I'm very grateful for your attendance. This is our 8th World Congress on Sepsis, and the congresses have grown over the years and have covered a diverse list of topics. Indeed, as Louis said, this is looking at some of the unmet needs in sepsis. I would like to thank the presenters who have given their time willingly to present during these sessions. I would also like to thank the wonderful office staff without whom this conference would not be held. They have worked tirelessly over the years, and indeed in this conference also, to make sure that this is a success. To those families and those with lived experience from sepsis, we hear you. We know there is a lot more need to be done, and we at the Global Sepsis Alliance pledge to you that we will continue to work tirelessly for your benefit. To those who are attending, we wish that you acquire some knowledge, get enthused by this, and to continue in the journey. The success of the Global Sepsis Alliance relies on everyone, and it also relies on the fact that while we can advocate in various areas, it is those who are working as clinicians across the world. They are the ones who have been through the COVID period and who are still working diligently. Also the patient and families who've suffered. As I said, we will continue to work for you. I'd like to thank you very much again for all who have participated. I'd like to thank the sponsors, and I'd like to thank all those who have contributed to make the GSA a success. And with that, I hope you enjoy the conference and get enthused by it, and I'll pass you on back to Louise.
Thank you, Tex, and thank you for those opening remarks. And I would echo that. Please get involved with the Global Sepsis Alliance. Have a look at the website if you haven't already to see things you can do to help with sepsis. So our first speaker today, unfortunately, cannot be here in person, but I would like to introduce you perhaps to someone who needs very little introduction. Originally trained in biology, followed by immunology, infectious diseases, community health, became Minister of Health in their native country of Ethiopia, but perhaps known to us all as the Director General of the World Health Organization, Dr. Tedros. Thank you.
Dr. Niranjan Kissoon, Professor Konrad, Reinhart, Dr. Mariam, Jashi, dear colleagues and friends. Sepsis accounts for nearly 1 in 5 deaths globally. For patients around the world, including in high-income countries, a seemingly uncomplicated infection can become septic, leading to hospitalization and often death. It does not have to be this way. Sepsis can be stopped through infection prevention and control, early point-of-care diagnosis, and timely access to appropriate and effective treatments. The WHO works with countries and partners to improve early sepsis diagnosis and treatment and implement safe clinical practices. We're currently developing new guidelines on the appropriate clinical management of sepsis. We're also developing policies for ensuring access to and appropriate use of antimicrobials, which are critical tools against multi-drug resistant pathogens that often cause sepsis. We support research and development efforts for these life-saving drugs. For the upcoming World Hand Hygiene Day in May, WHO will issue new guidelines for the prevention of bloodstream infections associated with the use of vascular catheters. Also in May, the World Health Assembly will consider a global action plan and monitoring framework for infection prevention and control. Thank you all for your continued commitment to this very important and preventable health issue. Nobody should die from sepsis. I wish you a productive conference, and I thank you.
Thank you, Dr. Tedros. Unfortunately, Dr. Tedros isn't here, and nor is our following speakers, so we can't have questions and answers for these two talks. But I will introduce you now to our second speaker, originally also an infectious disease doctor, but subsequently a member of Parliament for Portugal, the founding president of Unite Parliamentarians Network, the CEO of Health AI, which is the global organization for the responsible use of AI in healthcare, and also a council member at the World Health Summit. So I'm introducing Dr. Ricardo Baptista Leite.
Hello, my name is Ricardo Baptista Leite, and I am the founder and president of the Unite Parliamentarians Network for Global Health, a network of current and former members of parliaments, congresses, and senates from more than 110 countries, working with WHO and many other partners towards science-based policy making for global health. We are tremendously honored to be associated with the 2024 World Sepsis Congress Spotlight, particularly now that the World Sepsis Alliance has a very extraordinary new CEO who is also a former parliamentarian and Unite member, our dear friend Mariam Jashi. We would like to say that we are honored as the Unite Network for Global Health to be partnering with this initiative for many reasons, but most importantly because we truly believe that we have a mandate to make sure that every disease that is preventable be prevented and every disease that is curable be cured. That being said, we know that sepsis is an important cause of suffering and many deaths around the world. 10% of all people that end up in an intensive care unit in hospitals around the world are there because of a sepsis complicated disorder. That means that we have to do better. And we know that with the upcoming high-level meeting on antimicrobial resistance, that there is this year of 2024 a unique opportunity to put this very important topic on the political agenda. The reason why we believe that is because the world needs to understand, as many specialists have said, that the next pandemic, if it happens, will most probably be related to antimicrobial resistance and therefore will be related to sepsis. It is in our hands by investing more in research and development, in making sure that companies comply on investing in terms of the development of new technologies, but also in being more effective on the prevention side and redesigning health systems to avoid and react earlier on to onset infections, that we can be more efficient in making sure that sepsis does not continue to have the burden it has in our health systems, on people and their family, in our communities around the world. We can make the world a safer and healthier place if we come together, and we can do that also by tackling sepsis and putting sepsis on the political global health agenda. You can count on Unite to do exactly that, because we believe that now is the time to unite. Thank you.
Thank you. Okay, thank you. That marks the end of our pre-records for this session, and I'm very happy to say we will now be moving over to live presenters. So please feel free to use the chat, the comments, if you have anything you would like to discuss further or interested, relevant to these presentations. For anyone, I think, involved in sepsis throughout the world, the next speaker needs absolutely no introduction. A renowned researcher in sepsis, having published many, many landmark studies, the founding president of the Global Sepsis Alliance, and has been instrumental in so many initiatives related to sepsis around the world, including setting up World Sepsis Day, and I think is known to us all as an international champion of sepsis. So I'm very honored to introduce Konrad Reinhart.
As far as I understood our introductory speakers, they made a good intro into my talk and also for the talk which will follow by our esteemed colleague and new CEO, Mariam Jashi. The issue is, why need we reinvigorate global action on sepsis? Why is it critical? And I think the Director General has rightly pointed out that really we can stop sepsis, and the means are infection prevention, early recognition, clean care and management as an emergency. And he rightly called it a tragedy, thus most sepsis deaths are preventable. And this has been proven already between 1900 and 2070 in the US, where you see that in 2000, the crude mortality rate for sepsis or infectious diseases was 800 per 100,000 population. This decrease was only interrupted by the so-called Spanish flu. And the measures for this have been public health measures, such as establishment of departments of health, such as chlorination of water, such as better sanitation, such as introduction of vaccinations, and of course also antimicrobials as medicines. So the problem is, and the great tragedy is, that indeed we have a big problem when we look at this map. As it was rightly said, sepsis represents 20% of all deaths worldwide. However, the biggest burden is in the global south. And as you see, the incidence in some of these countries may be as high as 3,000 to 4,000 per 100,000 population. And this means that nowadays still the number of preventable deaths and deaths in these countries is over those numbers that have been in countries like the US at the turn of the very last century. And why is it? Because of poverty. And we have to overcome this. And if you look on the data which are out there, it's still the case that, and right, was Sir William Osler has said at this time, that humanity has three great enemies: fever, famine, and war. And of these, the greatest, by far, the most terrible, is fever. And these are the numbers, the shocking numbers. And we also know in the meanwhile that COVID-19, if you die from COVID-19, it's by sepsis. And of course, also AMR is a big issue, but we need to make a difference. And this not only applies to low-income countries, but also to high-income countries. So the quality of healthcare systems matters. In Australia, the death rate from sepsis declined from between 2000 and 2012 by almost 50%, just by measures by the introduction of so-called rapid response teams, which means the education of healthcare workers on all wards, on the early detection and of deteriorating patients, and also to have the possibility to ask for a rapid response team, which can help. And this not only helps this quality improvement, patients with sepsis, but also it dramatically reduced in Australia the number of cardiac arrests and elevated the response rate to resuscitation and et cetera, et cetera. And there's more data from high-income countries that demonstrated that by doing appropriate sepsis quality initiatives, you may not only save life, but considerably reduce healthcare costs. In the state of Victoria, by promoting an awareness campaign for sepsis in hospital, mortality rate declined from 17.5% to 11.30%. This went along with a decrease in hospital bed use by 3,500 days. The reduction in costs, healthcare costs, was in the range of 11.7 million Australian dollars, and the costs for the campaign have been 8.8 million Australian dollars. So it's highly cost effective when we are doing this. And the similar success stories have been also demonstrated by the Rory-Staunton regulation, where overall, after several years, mortality has decreased there from 30% down to almost 20% within 5 years. And this data published in the New England Journal also demonstrate that it's time critical. Sepsis, as it's set out in the WHO sepsis resolution, is a time critical disease, and any delay in antimicrobials leads to an increase of mortality. Awareness matters, and our good and esteemed colleagues from the UK Sepsis Trust have demonstrated it by their advocacy work and by their close collaboration with the leadership, healthcare leadership of the NHS and also the government. It was able to increase the number of patients who received, when they arrived in the hospital, appropriate care, which means antimicrobial therapies and other measures, from 30% to 70, 80%. And this went along with a considerable decrease, which is a dotted line, in mortality. And it's so shocking in some way if we look at the number of cases and deaths in Europe. And these estimates have been done on the occasion of the launch of the European Sepsis Alliance for 5, 6, 7 years ago. And based on the incidence that was found on sepsis in Sweden by hospital record analysis and the number of deaths and the death rate, we have at least 3.4 million deaths, 680,000 deaths and 3.4 million cases of sepsis in Sweden. And imagine, they also suffer, 75% of them suffer from long-term disabilities. And this could be reduced if we were able to implement these measures, which have been demonstrated as highly effective. And it's just ignorance and lack of leadership in the high income countries and not lack of resources, as this is the case in other places. And we also must overcome the poorly understanding that most deaths from pandemics add to the burden of sepsis. This was already set out in the report which accompanied the WHO sepsis resolution, mentioning that also influenza, dengue virus, SARS virus, MERS, coronavirus, etc., and really lead to sepsis. So this is not acknowledged. And if our healthcare leaders would have communicated this message during the pandemic, would have made a difference. It is unacceptable, and this is data from Massachusetts, where even during the pandemic, the incidence of hospital admissions to their hospitals in Massachusetts was 4 times higher than the incidence of viral COVID sepsis. This is the upper line. And what you see also on the right-hand side, that the mortality rate was in the range of 15% after some time. So we had a learning curve. This demonstrates also the effectiveness of vaccination, etc., etc. So we must convey the message that also long COVID people, the good news was that long COVID helped us to get the message across that infectious diseases, and especially also, of course, sepsis, comes along with long-term sequelae. And they only differ, not in principle, but just in terms of relationships. So overall, and this is poorly understood so far, they are the same, but just very, and it's preventable. The long-term consequences are preventable by early use, in this case, of COVID-19, by antivirals. And of course, also there is good data that demonstrate that vaccination reduces the risk for COVID-19. And there's data out from the US that Republican voters had a significantly higher mortality rate from COVID-19 than Democratic voters, because the reluctance by some vaccine hesitancy resulted in these differences in vaccination rates and also outcomes. And what must become different is our investments in awareness for sepsis. Currently, and this is data that we owe the CDC and especially the End Sepsis and Staunton Foundation, is much different between AIDS, AMR, breast cancer, for example, and sepsis. And this poor knowledge kills, because this is data from an official poll from Germany. The vaccination rates are very important, and they are lower in countries where not enough health efforts are made to improve sepsis literacy. And you may see this, for example, during the pandemic here, only 10% of the population knew the relationship between COVID-19 and sepsis, and also from influenza on sepsis. And still, on the left-hand side, you see that more than 2/3 of inhabitants think that only wound infections are a primary cause of infections. So we must no longer ignore, and especially the political leadership, which rightly set out under the leadership of the G7 presidency, that they did a statement: we need to intensify the efforts to strengthen early detection, diagnosis, and therapy of sepsis, and ensure that along with antimicrobial stewardship and IPC programs must become a national education, part of national educational campaigns. And this is not yet the case, because this proposal has not been taken up in the aftermath by the G7 leaders, by the G20 leaders, and this must be different. And finally, also the promise that the global health leadership and political leadership will also boost the implementation of the sepsis resolution has yet to be followed. And we are so grateful that GARP has joined our fight, because we need to and understood that not combining AMR campaigns with education on early recognition of sepsis may be harmful, because it may result in withholding antimicrobial therapy with antibiotics where it's badly needed. And regrettably, if you look at the fact sheet of the EU Commission, you will not find the word sepsis. They point out rightly that it's important, it's a health threat which costs 35,000 deaths in Europe. But compared to the more than 600,000 deaths from sepsis that we have at least in Europe on sepsis, we must learn that we need to make differences. So I encourage you all to join our vision, zero preventable deaths from sepsis, and thank you so much for your attention, and I'm happy to accommodate some questions if you want.
Thank you very much, Konrad. That was a really brilliant talk, and I think reminding us of the impact of sepsis globally and the cost, and importantly that lack of knowledge. Thank you for everybody who's posting things into the chat. We can see we've got participants here from all over the world, and that's wonderful. There is a comment here: by decreasing the prevalence of sepsis by 10% in Africa, we can reduce the number of sepsis-associated deaths worldwide by 20%. I don't know if you want to comment on that, particularly Konrad, but I think otherwise, I'd be interested to know, it's really interesting to see what's been done in high-income settings, but yes, in lower middle-income countries where the burden of disease is greatest, I'd be interested to know what you think are the important priorities and what would be the way to start dealing with this burden of sepsis in these countries.
Yeah, sepsis must become also a priority in their healthcare systems, and it's not yet the case. We are lucky that we jointly with our friends from the African Sepsis Alliance could use funding by the German Ministry of Science and Education with 7 countries in sub-Saharan Africa. There's a big stress also on capacity building, but rightly also that we work closely, and this has already started, with the leadership of the African CDC, with the leadership of the national health authorities to make this happen. Because as long sepsis is not on their agenda, in a continent where it's up to 10 times, several times or 20 times the incidence higher as in some low-income country is not acceptable. So they need to learn, and this is why our advocacy work and work also to really make the WHO sepsis resolution be implemented, which so far is only implemented in less than 10 countries, given that 49 member states have endorsed it. So this is also unacceptable 7 years after the launch of this resolution.
Thank you, Konrad. So I think now we are going to move on and remain with this topic really, but perhaps the next stage. I'm going to introduce the next speaker, a former Member of Parliament and the Deputy Health Minister for Georgia, the Global Board Member for Unite, which we've heard from already today, and the Secretary General of the Medical Women's International Association, and of course our new CEO at the Global Sepsis Alliance, Mariam Jashi. Welcome, Mariam.
Thank you, Louise. Dear colleagues, esteemed delegates of the World Sepsis Congress, it's an honor to present the basic framework for the new 2030 Global Agenda for Sepsis. The Global Sepsis Alliance is leading the development of the framework as the new multi-year strategic vision, how we collectively can reinvigorate the global sepsis response, make sepsis as the next success story of the global health, and reduce the immense suffering from this medical emergency. The document built on the past achievements and foundations led by the Global Sepsis Alliance and the Global Health Authorities. And some of the key foundations include the 2017 historic resolution of the World Health Assembly, adopted by the UN member states. In 2020, the Global Burden of Sepsis study developed the fundamental data and evidence for global advocacy, followed by the WHO first global report on sepsis. G7 health ministers' communique under the German presidency was another major achievement in putting sepsis in the mainstream of the political dialogue. And the latest Berlin Declaration summarizes the main roadmap for the reinvigorated global response. Clearly, the document highlights that without more investments and focus on the stronger global action on sepsis, attaining the Sustainable Development Goals and related aspirations for universal health care, antimicrobial resistance, or the pandemic accord would not be possible. The critical importance of sepsis response in attaining health-related Sustainable Development Goals is clear, as it affects up to 50 million people every year, including 5.7 million pregnant women and 20.3 million children under the age of 5 years. Sepsis is responsible for 10% of maternal deaths globally, 2.9 million deaths of children. And despite the contrary to the understanding that sepsis is primarily related to the infectious diseases origins, 5.1 million deaths associated to sepsis are caused by the secondary infectious complications of non-communicable diseases and injuries. Sepsis is clearly related to the antimicrobial research, antimicrobial resistance agenda, as up to 5 million deaths associated or attributable to antimicrobial resistance is part of the 13.66 million annual deaths related to sepsis. But in addition to the health-related goals, sepsis agenda is directly linked to 6 other sustainable development goals and targets. Poverty is directly correlated with increased sepsis mortality. Women are more affected than men, and therefore gender equality agenda is extremely pertinent and relevant for the sepsis agenda. Water and sanitation. With the current reality that 1 in 4 health facilities lack access to basic wash facilities. Sepsis drives inequalities as it primarily affects, as already mentioned by Professor Reinhart, the low and middle income countries. Climate change has the potential to exacerbate 58% of the known human pathogens. And finally, sepsis agenda calls for increased and stronger partnerships at the level of national policies, official development assistance, research and development, and global accountability. Based on the above, the new global agenda is structured around 5 strategic pillars, including political leadership and multilateral cooperation, health system readiness, whole of society approach, research and innovations, and sepsis in emergencies. Let me provide key highlights of each of the strategic pillars. Under the political leadership and multilateral collaboration, we shall ensure that sepsis is positioned in the mainstream of the global health agenda and high-level dialogue, including G7 and G20 summits, the World Health Assemblies, UN General Assemblies, the Unite Parliamentarian Summits, ministerial summits on patient safety, and other related global health priorities. Countries, at least 80% of high-income countries and at least 50% of low and middle-income countries should be supported and held accountable for adopting national action plans for sepsis, either as standalone documents or as part of the broader global health policies and strategies. We shall focus on national coordination mechanisms and alliances on sepsis, with engagement of both ministries of health and ministries of finance, as well as parliamentarians. We shall synergize sepsis agenda with the sustainable development goals, including integration of sepsis in universal health coverage, maternal and newborn child health, infectious prevention and control, antimicrobial resistance, the pandemic accord, and patient safety initiatives. Multilateralism would be key in the success of the global sepsis agenda, and we should call for allocation of both domestic budgetary resources as well as official development assistance from donor countries and international finance institutions. Global public-private partnerships, including Gavi and the Global Fund, should be approached for potential fiscal space for sepsis-related health system strengthening initiatives, and innovative funding such as Unitate for oxygen can be explored for potential financial support. And we shall definitely focus on global monitoring and accountability, as currently we practically have no data from sub-Saharan Africa that is affected the most by sepsis. So we shall prioritize development of epidemiological data and profiles, ensuring ICD coding amendments at the national level, sepsis registries, integration of sepsis in regular global burden of disease reports, as well as initiating biannual or annual global sepsis response for holding countries accountable for the World Health Assembly resolution commitments. The second direction, the second strategic pillar, will focus on health system readiness for sepsis, and it will prioritize, based on the experience of the UK, United States, currently on the CDC core element for sepsis, as well as Sweden and other countries. We have to prioritize development of evidence-based and patient-focused clinical pathways and sepsis bundles. We shall also ensure that equipment and supplies for sepsis bundles are available and non-interrupted provision of those commodities equipment is secured, starting with laboratory capacities and diagnostics to the life-saving organ support systems, including ventilators with oxygens, renal replacement therapies, patient monitoring, antibiotics, and other essential commodities. Special focus should be made on perinatal care for ensuring safe childbirth practices, and on the low and middle income countries, and sub-Saharan Africa and South Asia are the most affected by maternal and neonatal sepsis. Medical education and training, both in undergraduate curricula, postgraduate and continuous medical education systems, and focusing on active learning methodologies and using the digital capacities and telemedicine opportunities to close the existing geographic knowledge gap. Finally, from the health system strengthening perspective, we shall work on the regionalization of sepsis care, critical care, and comprehensive sepsis centers, similar to the initiative of France. And accreditation, voluntary and mandatory, as a standalone sepsis modules or as part of the IPC and patient safety accreditation. Cross-cutting health system strengthening initiatives should also support the routine immunization initiatives to ensure that at least 90% of children and adults are covered by the national immunization schedule antigens. We shall also ensure promotion of WASH infrastructure and the practices. And antimicrobial stewardship would be key, not only for ensuring that we facilitate strengthening of antimicrobial stewardship programs, but to ensure that the life-saving antibiotics or other antimicrobials are not held in the fear of the AMR practices, because time is critical in sepsis, and we shall be synergizing the actions both at policy and healthcare institutions level. Whole of society approach is strategic pillar 3 that will focus on sepsis prevention in communities through health education, routine immunization promotion, and hand hygiene practices, promoting sepsis as medical emergency and promoting critical care seeking behavior, engaging public leaders and media with the World Sepsis Day movements, context-tailored sepsis campaigns and special toolkits and trainings, and patients for patients continuum of care initiatives at the community level, starting from alert systems to post-hospital discharge care and rehabilitation services. The strategic pillar 4 focuses on sepsis research and innovations, calling for more investments in sepsis research, especially from public funding, and the US BARDA experience, the Biomedical Advancement Research and Development Agency experience, is one of the success stories. And Professor Reinhart also mentioned the STAIRS initiative supported by the German government for sub-Saharan Africa. We shall focus on academic cooperation and resource hubs similar to the Sepsis Science Info Center run by the German Sepsis Foundation, as well as the George Institute for Global Health. And in terms of public-private partnerships for research and development, the priority should be given to more investments and possibilities for novel vaccines against infections leading to sepsis, diagnostics including biomarkers, molecular and point-of-care tools, therapies, both antimicrobial and immunomodulatory therapies, and the artificial intelligence tools that are promising in terms of early detection and management of sepsis. Finally, sepsis is a multidimensional and complex issue calling for multi-sectoral response, and we have to ensure that sepsis is integrated in the pandemic accord and national pandemic prevention, preparedness and response plans. We have to focus on strengthening readiness of the health services of ministries of defense and peacekeeping forces in the current ongoing and devastating armed conflicts around the world. We have to ensure that humanitarian protocols integrate sepsis response, and the aid workers and affected communities are provided with capacity building initiatives and awareness toolkits. We have to focus migrants and displaced populations, especially in the refugee settlements and camps, through promoting the sepsis alert systems and critical care seeking behavior. And finally, we have to advance in advocacy and dialogue with climate action stakeholders, highlighting the sepsis risks and the readiness at the level of the Conference of Parties or other forums. The global agenda for sepsis, as mentioned, is under development. It's a Global Sepsis Alliance-led strategic development process that will ensure active engagement, participation, and inclusion of multiple stakeholders. The document will become the common roadmap, both for action as well as partnership and resource mobilization for the global sepsis response. And in terms of the timelines, we have already started the internal review of the documents, and in May and June, we will offer the draft global agenda for external consultations, including at a face-to-face strategic dialogue meeting on May 28 on the margins of the World Health Assembly. And finally, the formal presentation and launch of the document will happen at the World Sepsis Day in September, followed by UN General Assembly, high-level meeting on AMR, and World Health Summit and Unite Summits in October. I thank you for your attention.
Thank you so much, Mariam. That was a really, really actually inspiring talk, highlighting, I think, the number of organizations that are needed to be involved, but actually inspiring because there seems to be some real progress happening there, partnerships, and the acknowledgement, as you said, the society-wide initiatives that need to happen to improve sepsis outcomes. I can see on the chat the large number of positive comments thanking you for your talk and how inspiring it is. And I think probably it's such a great way to move forward to the next part of our session today. You know, you've highlighted partnerships and how important it is to work together, some of the work of the Global Sepsis Alliance. And we'd now like to play some small messages from some of our partner organizations. So thank you, Mariam, and thank you for joining GSA as well.
It's an honor and pleasure. Thank you.
Sepsis is one of the most common but least recognized medical conditions. Few practitioners and policymakers understand the full burden of this disease. Sepsis accounts for almost 20% of all global deaths. Half of all sepsis cases occur globally in children. 2.9 million children who die from sepsis are under the age of 5. Programs that address the underlying causes of sepsis, including bacterial infections, malaria and other parasitic infections, and viral infections, have a role to play in preventing sepsis by getting diagnosis and treatment right from the start at the community and outpatient level and looking for early signs of sepsis. Unless we prioritize preventing, diagnosing, and treating sepsis, we'll continue to lack the investment and political will needed to save lives. The good news is that we know what to do. The Berlin Declaration on Sepsis, released last year, is both an urgent call for action and a roadmap on global response to sepsis. Thank you.
GARDP is an NGO with a mission to preserve the power of antibiotics. Antibiotics are a key component of treatment of sepsis. Sepsis is a global killer, and early recognition and adequate treatment are critically important to save lives. The continuously increasing spread of antibiotic resistance is impacting the treatment of sepsis in multiple ways. If antibiotics don't work, there will be increasing episodes of sepsis due to bacterial infections that can then spread and overwhelm the immune system on the one hand. On the other hand, the lack of effective antibiotics to treat people with sepsis will result in more complications, longer hospital stays, and more deaths eventually. GARDP's work to research and develop new antibiotics, to keep older antibiotics working longer, and placing the spotlight on issues such as neonatal sepsis is integral to the prevention and treatment of sepsis.
MWIA is an association of female medical practitioners with a key objective of impacting on global health, and in particular, women's global health. The global health architecture for sepsis is hugely important to us because we have a strong voice of advocacy. We raise our voice in support of sepsis-related policies, laws, and regulations at international, national, and subnational levels. We raise awareness of sepsis in our communities, as well as in the corridors of power. It's important that we improve care and quality of life for millions of people affected by sepsis. I invite you to now enjoy the Congress.
Thank you. And we are shortly about to close this session. I'd like to thank all of our speakers, whether they be live or have made pre-records for us for this session. Your time and consistent efforts in the fight against sepsis are greatly appreciated. I'd like to thank our sponsors for the whole Spotlight event, and I would encourage you to keep listening to the sessions as they come up. As I said, you'll be able to, while the meeting is live, go back and listen to the sessions, and then thereafter you'll be able to subscribe and download the sessions weekly from the 7th of May, either through Apple Podcasts or on YouTube. I'm going to close out the session now, but before we go, I'd like to remind you all really that above all, sepsis affects individuals. We've heard a lot about statistics globally and how important it is, but at the heart of it, it is something that affects individuals, families, and communities. And I'm going to leave you with some thoughts from Duncan Brown, who is the father of a son who was tragically lost to sepsis exactly 20 months ago today. Thank you.
Hello, I'm Duncan Brown. I'm Kissoon's father. I understand the challenging environment clinicians need to work in which we bring ourselves and our loved ones. We're in this together. We live with the guilt of not knowing some basic fundamental knowledge about something so profound. And we also live with the guilt of allowing a power imbalance between us and the clinician prevent us from acting on our instincts. Parents inherently know their children. Trust our instinct. Use it as a source of courage to respectfully challenge and ask the questions you need to ask. Patients and clinicians, we have a mutual responsibility to truly listen. And there has to be mutual respect in our shared purpose to avoid the devastation caused by something that is preventable. Thank you.